Two friends, Felix and Danny, met after over 30 years of not seeing each other in front of Felix's house.
Felix, long time no see.
Indeed, my friend, it's been a while.
Since I relocated to the capital, I haven't come around, due to the nature of my job.
I know that Danny and don't hold it against you. How was life in the city?
It isn't easy, my friend, but there are opportunities there.
Of course. There should be.
Felix, this one you are wearing spectacles. I remember you always condemn using glasses, claiming that people just use it for unnecessary fashion and to show off.
My friend, mine is due to necessity. Lately, I have been experiencing blurred vision along with other symptoms like severe thirst, frequent urination, tiredness, incessant hunger, numbness or tingling in the feet or hands, massive weight loss and slow wound healing. The glasses help me with my vision.
This sounds serious.
It is, my friend.
Where did you get the glasses?
In church, during a health seminar.
Have you gone for medical checkup?
Checkup? What for? I am okay. I don't have any illness if not for how I feel.
From what you just complained to me, you don't feel normal. You need to go for a checkup to confirm the cause of what you complained of and how to deal with it.
You are right. I think I have to visit the clinic for checkup like you suggested.
Felix went to the hospital the next day for medical examination to confirm the cause of his symptoms.
Good morning, mister. I am Dr. Brown. How can I be of help to you?
Good morning, doctor. My name is Mr. Felix. I came because I don't understand how I feel lately.
Please elaborate.
Lately, I observed blurred vision, frequent urination, fatigue, increased hunger, slow wound healing and many others.
Do you have a family history of diabetes?
I don't understand what you mean, doc.
Have other members of your family suffered from diabetes?
Yes, doctor. My both parents were diabetic. I was told their parents also suffered diabetes. As I speak with you now, my elder brother is battling with a wound which have failed to heal for over 4 years now.
My reason for asking is that your symptoms sound like symptoms of diabetes mellitus.
Doctor, what exactly is diabetes mellitus?
Diabetes mellitus is a disease characterized by high blood sugar. You know that carbohydrates are sugars. Whenever you eat a carbohydrate-containing food, your pancreas secretes insulin, which makes your liver, muscle and fat cells to convert the excess glucose in your blood to glycogen, which can be used later, as well as to create a fairly steady state, for optimum functioning of your body. If your body is unable to convert excess glucose to glycogen to be stored, it means that all the glucose or sugar that enters your blood remains in the bloodstream, and that is not a good thing, because it alters the isotonic condition of the blood, and this have serious consequences.
Doctor, are you saying that my body is not producing insulin anymore?
We are yet to find out. It is not in all cases of diabetes that the patient doesn't produce enough insulin. I need to run some tests with your urine and blood to confirm if you have diabetes and what type. You need to be here tomorrow morning, when you haven't had breakfast, for me to take your samples, so as to check your fasting blood sugar level. After which you need to return 2 days after, to get the result.
Okay, doc, I will do just as you have said. I will be leaving now.
Felix met Danny in the evening, when going to purchase some things at the village square.
Good evening, my friend.
Good evening, Danny.
You seem to be so tired.
I am, my friend. I am just managing to go by what I will eat this evening, at the market square. Please let me sit. I feel like fainting.
Did you go to the hospital, as we discussed the last time?
Yes, I did. I went to the hospital today. The doctor asked me to come tomorrow morning, for sample collection so as to check if I am actually diabetic and what type. I will be there first thing in the morning.
Okay, my friend. Please let me allow you go by what you are going for. I will check on you by the weekend. I am going to the city for a clearance tomorrow.
Okay, Danny. We will see later.
Felix did exactly as the doctor instructed. 3 days later, he went to the hospital for result of the test.
Welcome, Mr. Felix. Please sit. Mr. Felix, the result of the test is out and it indicates that you have type 2 diabetes.
I don't understand what you mean by type 2.
There is type 1 diabetes as well as type 2 diabetes. Type 1 diabetes is an autoimmune disease, caused by damage of the cells in the pancreas, responsible for production of insulin, by the white blood cells, which results to low production or inability to produce insulin, the blood sugar regulating hormone. while type 2 diabetes is called insulin resistance. In this type, the patient produces enough or even excess insulin, but his or her liver, muscle and fat cells does not respond to the hormone.
Doctor, are you saying that I am dying?
Not at all.
What is the cause of diabetes?
Possible causes of type 2 diabetes are 1. Polycystic ovary syndrome, which is a hormonal problem that affects women. 2. Sedentary lifestyle or inactivity or low level of physical activities. 3. Gene and family history of diabetes. 4. Overweight or obesity. 5. Maternal gestational diabetes. 6. Being over 55 years of age. 7. Race or ethnicity. 8. Poor diet or heavily depending on carbohydrates with high glycemic index as daily source of carbohydrates. And 9. Alcoholism.
But doctor, I don't drink alcohol. Although, I hate long walks and exercise because it makes me sweat and weak. Doctor, please, what do you mean by carbohydrates with high glycemic index?
Glycemic index or GI is a measurement that ranks foods containing carbohydrates according to how much they affect or raise someone's blood sugar, whether quickly, moderately or slowly. Dependence on foods with high glycemic index is the leading cause of diabetes in most developing countries, where majority of the citizens depends on tubers as their daily carbohydrate source.
Doctor, to be honest with you, I eat Gary at least twice daily for as long as I can remember. Are you saying that could be the cause of the symptoms I'm observing lately?
Possibly.
Doctor, is diabetes curable?
Type 2 diabetes cannot be cured, but people with the condition may be able to manage their condition through lifestyle changes and, if needed, diabetes medications to control blood sugar level. I recommend that you change your diet to an adequate type for your condition. Avoid carbohydrates with high glycemic index.
This will not be easy. But how do I know carbohydrates with high glycemic index?
A person who wants to manage his or her weight or diabetes can find out the glycemic index of foods from the International Table of Glycemic Index and Glycemic Load Values using Google or any other search engine. Diet and exercise are the foundation of diabetes management. Changes in diet can improve many aspects of type 2 diabetes, including helping to manage your body weight, blood pressure, and your body's ability to produce and respond to insulin. Being active and having enough rest, especially at night, will be helpful too. At least 7 hours of night sleep is recommended. For your children and younger ones whom have not developed the condition, here are ways they can prevent having diabetes mellitus. 1. Eating a healthy diet. 2. Weight loss and avoidance of obesity. 3. Smoking cessation. 4. Exercise. 5. Avoidance of alcoholism. 6. Being active. 7. Drinking plenty of water. 8. Staying physically active. 9. Consuming high-fiber carbohydrates. 10. Moving more often, and 11. Reduction of total carb intake.
Okay, doctor. Thanks for your guidance. I will try to change my lifestyle since I don't have any other choice if I will have to live a healthy life. I will be leaving now.
Enjoy the rest of your day, Mr. Felix.
You too, doctor.
The end. Thanks for watching. Please don't forget to subscribe to the channel so that you will be notified whenever a new video is dropped. Like the video if you learned something from it, as a way of motivating the creator to keep dropping more. Comment your experience for others to learn from it. Also share this video to help many other people in need of it see it. Thanks and God bless.